name's Carolyn. I'm a nurse practitioner student, and I'm here to examine you today. I've already washed my hands and provided for privacy. Can you please state your name for me?
Joe Mama.
And your date of birth?
December 1990.
Okay, thank you. So I'm going to be doing a head-to-toe exam on you. Normally I'd have the patient take his shirt off to do this exam, but we're going to leave it on for the purposes of the video. I'm going to make sure that his bladder is empty before I start the exam, and I'm going to inspect the skin, noting any lesions, nevi, scarring, any masses. Can I check your fingers? Checking the capillary refill should be less than 3 seconds, which it is, and there's no clubbing. Next, I'm going to inspect your head, noting the distribution of the hair, looking for symmetry. The head is normocephalic. Then I'm going to palpate and noting any masses or lesions, any tenderness. Is there any tenderness there?
No.
All right, and I'm going to palpate your frontal sinuses. Let me know if you feel any tenderness, the ethmoid, and the maxillary. And then I'm going to palpate the temporal arteries, and the pulses are equal bilaterally. I'm going to auscultate your temporal arteries with the bell of my stethoscope. And I don't note any bruits. All right. Next, I'm going to have you open and close your jaw. And there's no crepitus or popping. I'm going to palpate your preauricular lymph nodes. Just tell me if you feel any tenderness. Those with postauricular, submandibular, submental, anterior cervical, and posterior cervical. And I don't note any enlargement or no tenderness. Supraclavicular and infraclavicular. Okay, so next I'm going to have you, I'm going to palpate your periorbital region as well, noting any tenderness, no swelling. All right, and then if you'll just look at me, I'm looking at your eyes. The sclera is white and clear. There's no injection, no jaundice, no drooping of the eyelids. The lashes curl up. So I'm going to use my light source and check for direct and consensual response. So on the left eye, it responds to light, it constricts. So I'm going to check his right eye, shining it in the left, and that is consensual response. And then the same thing, that's direct. His right eye constricts, and then checking again, the right eye, and the left eye constricts. Next, I'm going to do just check for the red reflex. So I'm going to stand at a 45-degree angle. I'm going to take these off. And I do see the red reflex there. And I see the red reflex. And normally I would also do a fundoscopic exam, where I would go in at a 15-degree angle and I would note the optic disc. The margins should be sharp. No nicks or hemorrhages should be noted. Looking at the vessels and the arteries of the eye. And then next, I'm going to do your ears. So I'm going to change out my speculum to the otoscope, using the biggest speculum that will fit in the patient's ear. First, I'm noting the ears. They're symmetrical. I'm going to palpate the ears. Tell me if you have any tenderness. I don't see any lesions. I'm going to pull up on the pinna. Any tenderness. Pressing the tragus. And the same thing on this side. No tenderness there?
No.
Okay, so I'm going to pull up on the pinna. All right. So I see the tympanic membrane. Is it pearly white? The cone of light is at 7 o'clock on the left ear. There's no redness, no cerumen, no drainage. And the same thing on this side. Putting my fingers out not to go in too far. The tympanic membrane is a pearly white. The cone of light is at 5 o'clock. And there's no cerumen, no drainage, no redness. And the bony landmarks are intact. Next, I'm going to swap out my speculum to the short fat speculum. And I'm just looking at his nose. It's midline, no swelling. So I'm going to take a look inside. And the turbinates are light pink. There's no swelling, no drainage. The septum is midline, no deviation. Same thing on the other side. The turbinates are a light pink. There's no septal deviation and there's no drainage noted. Next, I'm going to take a look in your mouth. So I'm going to first notice your lips are symmetrical. There's no lesions or vesicles noted, no fissures. And if you'll just open up for me, say ah. And the uvula is midline. Mucosa is a pink moist. Lift your tongue up. And note all his teeth are there. I don't see any dental caries. At this point, I could take a gloved finger and go in and palpate the inside of the mouth, noting any nodules or tenderness, which is deferred for this video. So next, I'm going to check your trachea to note that it's midline. I'm going to palpate it. And then the thyroid you can check posteriorly or anteriorly. In this case, I'm going to check it anteriorly. So if you'll just swallow for me. And it's mobile, it moves up and down. There's no nodules, no enlargement, no tenderness. So that's good. Okay. So next I'm going to check the thoracic. Like I said, I would have his shirt off in this normally. I'm looking at the skin again, noting any lesions, scarring, any masses, checking the skin turgor. And next I'm going to palpate, noting any masses or tenderness, no crepitus. And then posteriorly. Okay, and I'll check laterally. Okay, next I'm going to percuss, starting at the apex and working my way down in the intercostal spaces. And it should be resonant all throughout. Okay, and I'm going to do the same thing posteriorly. Okay, and I'm going to do it laterally as well. Okay, so any dullness could indicate fluid or masses, but I did detect resonance throughout. Next, I'm going to auscultate. I've also inspected your thorax to see your respiratory rate and rhythm is regular, no use of accessory muscles or retractions. So I'm going to auscultate. Take a deep breath in through your mouth. gonna check the sides. The other side. Okay. So breath sounds are vesicular. I didn't know any adventitious sounds like wheezing, rhonchi, crackles, or rails. If I can have you stand up and face the wall. So I'm going to check thoracic expansion, placing my thumbs together at the 10th rib, and then if you'll breathe out. Let's try this again. Okay, breathe out, in and out. Okay, good. So thoracic expansion is symmetrical. That's good. And then you can have a seat for me. So next I'm going to check the cardiac. This is the cardiac portion of the exam. Again, I would have your shirt off normally, and I would note the precordium, inspecting it for any lifts or pulsations or heaves. I'm going to check the right second intercostal space at the right sternal border, which is the aortic. So I'm going to palpate that. And then the left intercostal space, second intercostal space on the left sternal border is the pulmonic. And then third, fourth, and fifth intercostal space at the left sternal border is the Erb's point and tricuspid. And then you have the fifth intercostal space at the midclavicular line is the mitral. All right, and now I'm just going to listen. We don't percuss the cardiac portion of the exam. So with the bell and the diaphragm of my stethoscope in all of these places. Okay, so I don't note any clicks, rubs, murmurs, or gallops. I hear S1, S2, which is normal. So next I'm going to have you lie back. And I'm going to perform the same exam on your heart again as we did sitting up. So I'm just going to listen in all of those areas. Okay. Okay, again, I hear a normal S1, S2 sound. I don't hear any clicks, rubs, murmurs, or gallops. And I'm going to check your carotid artery. So first I'm just inspecting, looking for any pulsations, which I don't see any. I'm going to palpate one at a time. Okay, and then with the bell of my stethoscope, I'm going to auscultate. Okay, and I did not hear any bruise, which is a normal finding. I'm gonna have you turn your head to the left, and I'm just looking for any jugular venous distension, and then if you'll turn it to the right, and I don't see any jugular venous distension, and you can actually measure less than 3 centimeters is a normal finding. Next, I'm going to palpate your pulses. So I'm going to check the brachial. And your radial. Okay, and then I would check femoral, which I'm not going to do at this time. Can also, while you're there, check the inguinal lymph nodes for any tenderness or swelling. Then with preferably no clothing, I'm going to check the popliteal. And then I'm going to check the dorsalis pedis. And the posterior tibial. Okay. So now I'm going to have you, let's see, I'm going to go ahead and inspect your abdomen. Do you feel comfortable pulling your shirt up? So first I'm looking at the skin, noting any lesions, nevi, scarring, which I don't see any. The abdomen is protuberant, and I'm going to go ahead and auscultate. Starting in the right lower quadrant. Right upper quadrant. Left upper quadrant. And left lower quadrant. And then with the bell of my stethoscope, I'm going to listen to the arteries, starting with the aortic, which is just above the umbilicus. And then the iliac. And then the renal. And then the femoral. I did not hear any bruise, which is a normal finding. While I'm here, I'm going to go ahead and note any pulsations in the aorta. I don't see any, but if I did, I would palpate and walk my fingers out until it stops, and then I would measure the distance between my fingers. Okay, so now that I've auscultated, I'm going to percuss, starting in the right lower quadrant. Right upper, left upper, and left lower. And the sound is tympanic, which is a drum-like sound, which is normal. If it were to be a dull sound, it could indicate a mass or fluid. So next I'm going to palpate lightly, starting in the right lower quadrant. And just let me know if you have any tenderness. Right upper, left lower. And then I'm going to deeply palpate in the right lower. I'm also going to check for rebound tenderness. Let me know if you feel any pain. Okay. Okay. And I've checked all 4 quadrants. I'm also going to percuss for the liver span. So I'm going to start in the right lower quadrant and just work my way up until I hear dullness. And I'm going to start at the second intercostal space, making note of where I stopped when I heard dullness, and then work my way down. Until I hear dullness. And the liver span should be between 6 and 12 centimeters. And then I'm going to check for splenic dullness. So you would go to the lateral aspect, the abdominal process, and it's just under the left rib cage, and you would percuss. Okay? Alright, so you can put your shirt down. Can I have you stand up for me and face the wall? I'm going to check for CVA tenderness. Any pain with that? Okay, good. So now you can have a seat. So the next part of the exam would be genitourinary, which is deferred for the purposes of the video. But women ages 25 to 40, they recommend every 3 years breast exam. After the age of 40, they recommend it yearly. For a pap and a pelvic, they recommend that women ages 21 to 65 are screened for cervical cancer. Some tests that can be done are KOH and GC probe. For men, we look at the Tanner stage, should be a 5 in an adult male. A testicular exam is done yearly, and when they're symptomatic, prostate cancer screening or prostate screening is done age 50, and then you can also do a hemocult at that time to check for blood in the stools. Okay, so now we've done the abdomen, we've done genitourinary, so I'm going to move on to musculoskeletal. So if I can have you stand up and face the camera, and I'm going to have you flex your head forward and extend it back, and then rotate it side to side, and then laterally bend it ear to shoulder. Okay, and then just try to press against my hand, okay? And then if you'll shrug your shoulders up, checking for strength in your shoulders. If you want to do this at the same time, you can, both arms. I don't know if you have enough room, but if you'll abduct, which is bringing them out, and then adduct, you'll bring one across your chest, and the other one across your chest. And then internal rotation, so you're going to bring them in this way, and external rotation. Okay, so next we're going to check your elbows. You can face the camera for this. If you'll extend your arms out and flex them in, okay, and then press against my hands, pull against them, okay? And then we're going to check your wrists. So if you'll go up, down, and then side to side, we're checking for ulnar and radial deviation, which I don't see any. All right, and then if you'll extend your fingers out and flex them in, and then that's abduction, adduction, and then squeeze my fingers, checking for strength of your fingers, which is good. All right, and then you can lie on the bed, and we'll check your hips. You want to turn on one side. If you can raise your leg up, and then press against my hand, and then swing it in front of you for adduction. All right, and then internally rotate it, and externally rotate it. Okay, and then if you'll flip sides, and we'll do that on this other side. So we're going to abduct, raise your leg up, and then press against my hand. All right, and then swing it in front of you, and then we're going to internally rotate it and externally rotate it. Okay, and you can lie on your back, and we'll check your knees. So if you can flex your knee up, okay, and then press against my hand, okay, and then extend it out, and then we'll do the same thing on that side. Press against my hand, and then extend it out, and then I'm going to check your ankles. So if you'll point your toes to your nose, and then step on the gas pedal, okay? And then I'm going to check again your strength, the dorsiflexion, toes to your nose, and plantar flexion, step on the gas pedal. Okay, so musculoskeletal exam, muscles are intact and your strength is equal and bilateral. So let's see, next I'm going to do the neurological assessment. So you can sit up for this. Alright, so first off, I'm going to say 3 words. I'm going to have you repeat them back. Baseball, apple, lamp.
Baseball, apple, lamp.
Okay. And do you know the day of the week?
No.
You don't know the time, the date?
Tuesday.
Do you know where you are?
Yeah.
Okay. So for the purposes of video, we won't have you state where you are, but memory is intact and he's alert and oriented times 4. Alright, so next I'm going to have you close your eyes. I'm going to close one near and smell that. And tell me what you smell.
Coffee.
Alright, great. And then we would check the other side, preferably with a different scent. So that's cranial nerve 1. That's the olfactory nerve, which is intact. Next, I'm going to check cranial nerve 2, which is the optic nerve. So I've already done this earlier, but I'm going to check again your reaction to the light. So pupils constrict equal and bilaterally, and they're accommodating to light. So one more test for the optic nerve, cranial nerve 2. Tell me when you see my fingers.
No. No. No.
Okay, so peripheral vision is intact, so cranial nerve 2 is intact. Next, I'm going to check cranial nerves 3, 4, and 6, which is 3 is the ocular, 4 is the trochlear, and then 6 is the abducens. So for this, I'm just going to have you follow my finger, the 6 cardinal fields. Okay, so cranial nerves 3, 4, and 6 are intact. Now I'm going to have you clench your jaws and then move your jaws side to side. Okay, and tell me when you feel something sharp or soft on your face.
No. No. No.
All right, so that's the trigeminal nerve, cranial nerve 5, and that is intact. Next, I'm going to check cranial nerve 7, which is the facial nerve. If you'll puff out your cheeks and smile and frown. Okay, so cranial nerve 7, the facial nerve is intact. Next, I'm going to do the whisper test. This is cranial nerve 8, the acoustic.
Chair.
Mm-hmm.
Baseball.
Okay, great. Now while we're at it, I'm going to check your the Weber and Wren test while we're checking the acoustic nerve. So this is going to, first I'm going to strike this and place it on your forehead, and if you can tell me if you hear it louder on one side or the other, okay?
All right here.
Okay, so it lateralizes to the right, which is an abnormal finding that can indicate hearing loss in the left. So now we're going to check, I'm going to place this on your bone, the mastoid process, and you tell me when you no longer hear it, and then I'm going to move it to your front, and you tell me when you no longer hear it.
All right. Okay.
Okay, so air conduction is greater than bone conduction in the right ear, which is a normal finding.
Okay. Okay.
Air conduction is greater than bone conduction. All right, so moving on to cranial nerves 9 and 10. That is the glossopharyngeal and the vagus nerve. I could elicit the gag reflex at this point, but I'm not actually going to do that. But if I can have you just open up again and say ah. Okay, and the uvula is midline. The soft palate raises, which is a normal finding. So cranial nerves 9 and 10 are intact. And if you can just stick out your tongue. Okay, and it's midline. If it deviated to the right, it could indicate right side of brain damage, and if it deviates to the left, it could indicate left side of brain damage. And then again, I'm going to have you shrug your shoulders. All right, and spinal accessory nerve is intact. That's great. One other thing with the musculoskeletal, if I can have you stand up and face this way and bend forward for flexion, and then stand up for extension, and then rotate, and then bend laterally side to side. Okay, and that's checking your the strength in your spine, so that was good. And then at this point we're done. Oh, we're not quite done, so I've got a couple more things for you to do. If you can hold your arms out like this and close your eyes for about 10 seconds. And this is checking for pronator drift. Okay, and there is no pronator drift noted, which is a normal finding. If you can touch your nose with your finger and alternate, and that's checking coordination, and that's intact. Okay, cerebellar is intact. Next I'm going to have you walk in a straight line, heel to toe. That's the tandem walk. Okay, and that's good. You can have a seat right here, and I'm just going to check your sensation. Tell me if you feel something soft or sharp.
Soft. Sharp.
Let me raise your pants leg up. Okay.
Soft. Sharp.
All right, so sensation is intact. So that's the end of the neurological assessment. The only thing I have left is health promotion. So we would screen for substance abuse and alcohol abuse, as well as depression, anxiety, and any eating disorders. And one other thing, colonoscopies, we recommend patients age 50, either male or female, have a colonoscopy at age 50. And that is the end of our exam. Do you have any questions? Oh. Thank you. I do have one more thing. I'm going to check your reflexes. So if you'll just hold your arm out. And this is the biceps. And the triceps. And brachioradialis. Okay, and same thing on the other side.
Is it working?
Mm-hmm. Yeah, it looks like it. So that's the biceps and the triceps. And the brachioradialis. Okay. And then I'm going to have you lie down and I'll check your, well, I can actually do your patella first. So. Yep. And then your Achilles. Okay, and then if you'll lie back and I'll check your babinski reflex. And I'll just use this, the end of my tool here, and I'm going to go up laterally and then across the ball of the foot. And I'm not seeing any response, which is a positive babinski, which could indicate some nerve damage, which we've established. All right, do you have any questions for me?
I don't think so.
All right, so that's the end of the exam. Thank you.